All right, folks, Kevin here. We're going to go through the Zoll X Series monitor that you have on the aircraft. I'm going to kind of hit this kind of hard and fast, and just know that we will get this in a lot more detail when you get with your preceptors when you start with your preceptors. Some of the basic functionality, first and foremost, these arrow keys are going to scroll through. And if you look right up here, what's highlighted is what you're scrolling through. So if you were wanting to highlight and put this in pediatric mode because it resets the alarm values, you would go to the mode and then you would click this enter button right here, and you can go down to pediatric or neonate. Again, that just sets or changes alarm parameters for like heart rate and blood pressure. So we're going to keep it on adult mode. Right beside it, this little indicator here just lets you know if it's green, it's good. So if you're trying to upload your vitals, if it's not green, they're not going to upload. We change the time and the date right there. We're not worried about that except probably twice a year. And then we're going to kind of come down and we're going to look at these left-hand soft keys. So we're going to start on page 1. This is going to come up when you turn your monitor on. This is going to be your lead select. You can cycle through 1, 2, 3, AVF, AVR, AVL right here. 12 lead, if you can put your patient on 12 lead, you will hit this 12 lead button. You will fill out male, female. It'll ask you some information. You just put that in. Entitle CO2, as soon as you walk in the door and you turn this monitor on and your patient is intubated, you go ahead and hit this entitle CO2 because I'll shut it up. It takes it a few minutes to initialize. So it's not going to instantly come up. It has to go through a self-test. It has to initialize. Once it initializes and you put your patient on entitle CO2, it will populate in this bottom window. The RX button we're not going to worry about. Sync is if you're going to synchronize cardiovert somebody. That is your sync button. This is your print button, and then this is your page 2 button. So you go to page 2, and these are your parameters over here. This is going to be a classic invert, so you can change this and invert it for day or night. We don't fool with that much, but it is there if you need it. The IABP, stand by. The IABP button right here, like Casey said in a previous video, this is how you would zero your A-line or your whatever transducer. So you would hit, if we had an A-line cable set up, this populate A-line 0. You would turn the stopcock toward the hard portion of the line or hard side line, take your cap off and hit 0, and it will say 0 down in this corner. We'll go back and we will go on to this other side. We got buttonology over here. This is going to be your home button. If you want to change the view, you can hit this right here. It'll give you a different view, but we keep it on this by default. This is the most important button on here. This is a shut up alarms button. You push this whenever it's beeping at you a whole lot. It will silence it for 2 minutes. This is a snapshot button right here. It looks like a little camera. So if you have a patient that just went into a different rhythm and you want to catch it, you can hit that snapshot button. It'll back up and record for some time frame prior to. Or a lot of times I do it when I'm turning over into the ER. I will hit that snapshot button in order to catch a current entitle waveform. So just if your patient is intubated. You've got your manual blood pressure cuff right here. You can hit this button. It will start to inflate your blood pressure cuff. So if you need to take a reading, you can do it right then. And you can stop it as well. Down here on the bottom, this is how you turn your pacer on. There it is right there. If you want to change it to fixed, you can go to there, hit fixed, and then hit your enter button. You can set your rate, you can set your milliamps, and that's how you would do that. Hit your back button, stand by. And then there's going to be your values right there. Analyze, this monitor will go into AED mode. We don't use that. If you're going to defibrillate somebody, you hook up your therapy cables. We're going to turn the pacer off first. All right, so we would select our energy levels here. It's going to default to 120. It's going to give what the patient needs. So if you've got somebody, these pads are smart pads. So you may defibrillate somebody, you think you're giving them 120, it's going to measure the impedance of the patient and it's going to shock it, whatever. So it may print out at 110 or 125. So anyway, you select your energy there, and this will go all the way up to 200. Again, this is biphasic, so it doesn't go up much higher than that, and you can go all the way down to whatever energy. Once you get to that point, you can hit charge, and then once it's charged and you clear your patient, you can hit shock, all right? So one of the most important things that you're going to do after every call is you're going to go into this log. So look over here on the left-hand side, you'll go to page 2, you will hit log, and then this envelope right here is going to be your case. You're going to close your case out. So in this instance, we're going to close this case out and come over here to select. It's highlight close case. We just close that case out. So when you get ready to upload your case, this has got to be green. We will select a case. So here it is right here. So you'll start up here and select your case. Get back to here. Put a check mark right there. Once you get the check mark, that is going to transfer that case right there. You'll hit home again, then it highlighted transfer, and you push enter, and it's going to upload your case. So you'll do this on every single call, every single flight. So anyway, that is a basic overview of the side, the end title. Is your end title waveform capnographer tubing is going to screw in right there, just a quarter turn in a clockwise position. This is where you hook up your blood pressure cuff, your end title, your EKG cables, and on here, if you're going to do a 12 lead, you're going to connect your 12 lead cable bundle. Stand by. Right here. It's on the side of this. There's your 12 lead cable bundle. You'll connect it there. On the other side of this monitor is, again, we talked about this before. You've got your therapy cable, which is in your blue bag. You have your P1 for your A-line, and down here you have your temp cable that is in your miscellaneous bag. To change the battery out, you need to look at this. This is something that's very important. You need to check it the first of your shift every day. You'll do a battery check, so you'll hit this button, and it will give you 3 or 4 in the green. If you got 3 or 4 in the green, you're good. If you need to change it out, you just lift this up, slide the battery out, slide a new battery back in, but make sure before you put a new battery in off the charger that you actually do test it. I think that's about it. Okay. And we will go over with you in greater detail. You'll get very familiar with this monitor. That's all I got to say about that.